Hey everybody, this is Laura. It's that nurse. I am here to kickstart our 7-day CNA review. I'm excited because this means that there's more CNAs that are entering into the industry. Welcome, welcome, welcome. We need you. We couldn't do it without you. But I want to help you be successful on your state exam. For those who don't know me, my name is Laura D. Williams, and I co-own Williams Career School of Excellence here in San Marcos, where we train in-demand training like CNA, HVAC, phlebotomy, medical assistant, and medication aid, to name a few. And we love to invest in our students and to ensure that they are prepared to pass their state or national exam. So let's get started. First, we're going to be talking about key tips to help you navigate the CNA exam questions. A lot of times, students are feeling very confident about their skills, but sometimes when they're having questions, it can get a little tricky. So, I want to give you some of the tips that have helped our students and helped them pass their exams successfully. First of all, number one is understanding key terminology. So, as in an example here, you want to know CNA terms like aseptic technique. Anybody knows what aseptic technique is? Put it in the comment section. I encourage you to engage, be okay with making the wrong choice, selecting the wrong choice, because this is what learning is about. If you didn't learn, if you knew everything, then you wouldn't be learning, right? So it's important to just be engaged. It helps with your learning and retention of information. Aseptic technique is a technique that is going to be utilized in most situations that a CNA has involved with. We have what we call sterile technique, which is more of a nursing type technique. We have certain gloves we're going to use. We're going to protect surfaces a certain way to ensure that this is a sterile environment. Aseptic could also be seen as clean and just means that that area has been cleaned and wiped down in a very effective manner. But it's not sterile because let's say you're in a resident's home environment, for instance, it's almost not impossible, but it's a lot harder to create a sterile environment. But when we think about aseptic, we also want to think about that you're doing certain things. You're incorporating gloves, hand washing, things of that nature to prevent the spread of germs. So if you didn't know what aseptic meant, for instance, you may be stumped on a question. Let's go to another common term, activities of daily living, or ADLs. If the test question used that term or abbreviation ADLs, you may be like, what is that about, right? So knowing that it stands for activities of daily living, and for those who are like, what is that? Those are the things that all of us do for ourselves when we wake up in the morning to get our day started and and throughout the day. We brush our teeth, we wash our face, we get dressed, things in that nature. So activities of daily living is the core role or responsibility of the CNA because you're supporting residents or patients with their activities of daily living. So understanding key terminology can be a key, I mean, it's a big key of success on a state exam. You want to make sure that you read the entire question. Take your time to read it. Don't assume that you understand what's being stated. Take your time and read the entire question and all of the answer choices carefully. You want to look for keywords like first, most important, or best to understand what the question is truly asking. For instance, if you have a question that says, what is the first response for the CNA to do or first to say when the resident says, I need help? I'm just throwing out a random question. But when you look at your answer choices, you want to look at what would be the priority question. For me, it may be like, what do you need help with, Mrs. Smith, right? Because I don't know what the help is. So it may be providing clarity. Most important, and a question that is saying, what is the most important, um, let's say, step the CNA should take in a certain task? You want to look at safety. You want to look at the patient or resident's well-being in relation to other possible steps you can take. What is the most important thing I should do in this situation? And the same thing for best. What is the best response if a resident is asking the same question over and over again? It won't be to walk off, right? It may be to sit and ask questions or listen to that resident. So first, most important and best can really make you understand, like, what is this question actually asking me in regards to that? And guess what? We will have questions. We're going to review 2 or 3 questions to give you an understanding of how these in type of words or keywords can be utilized in a question to help you direct you to the exact answer that is correct. Also, I forgot to mention, look in the description box. You can click on this link, and this document that I'm reviewing is actually there for you to take snapshots, use it, and print it out for your review. Number 3, eliminate wrong answer. So narrow down your choices by eliminating answers that are obviously incorrect. All right. That's a great like test taking strategy because you really don't want to focus on any question or answer rather that is, like that's just out of the question. You want to spend your brain energy on the questions, the answer choices that potentially is the correct answer. Number 4, think like a caregiver. You're like, duh, Miss Laura, like, what do you mean? You don't want to go in there thinking like a nurse. You don't want to answer the question thinking like a doctor. When I went to nursing school, one of the key lessons I had to learn in my first semester was I could not think like a CNA or medication aide any longer. I had to think like a nurse. We have a different scope, we have a different role, and we're responsible for different things. So you need to go into this test thinking like a caregiver. What is your role, right, as a CNA? If you are in the industry, the hardest thing that I find that students who have experience do is you take in real world experiences and bring it into the test. Leave it out of the test. Think about what you should be doing. Because let's be honest, in certain situations or facilities, you may be doing things that you shouldn't do, which is outside of your scope of practice. So your textbook, the training you've received from your school, should have been a good guider for you to understand what is my role, what is my responsibility. Your role focuses on patient safety, comfort, and care. All right, remember these 3 words: safety, comfort, and care. When in doubt, you want to choose an answer that prioritizes or puts first the patient's well being, their safety. 5, many questions revolve around infection control, hand washing, and the use of PPE, protective equipment, right? So you want to make sure that you understand when you should wash your hands, before and after care. When should you be applying gloves? Anytime you are potentially going to touch bodily fluids, because you want to use what we call standard precautions. You always want to think about how to prevent harm and the spread of infection. Number 6, stay calm, manage your time, pace yourself. Remember, you have more time, honestly, than you need. So just take your time. Don't focus on the time to the point that you're freaking out in the test. Take deep breaths, ground yourself. If breaks are allowed, at times it's good to take a break based on that policy of the testing center. So don't let questions overwhelm you, the ones that are challenging. If you unsure and if you are able to, mark that question, move on, and come back to it. All right. Just remember to know if this is a possible thing to do when you're taking the test. 7, this is important. This is something that we tell our students: practice common scenarios. Review standard CNA scenarios that are like assisting residents with feeding, transferring patients, taking vital signs. Knowing the correct procedures or steps will help you answer these type of questions. All right. So remember, click the link. You have this keys to prepping to pass your CNA exam at your will to utilize and to remember as you're prepping to pass. Let's go over a question. All right. So here we go. Which of the following is the most important step when transferring a resident from a patient from a bed to wheelchair? I always get patient and resident interchangeably. Certain facilities use residents, certain use patients. So, which is the following most important step when transferring a patient from a bed to a wheelchair? A, moving the wheelchair close to the bed. B, locking the wheels of the wheelchair. C, assisting the patient to a standing position. Or D, placing a gait belt on the patient. The reason why I like this question, and this question was created for this time, is every single one of these steps would be a step that you would do if you were actually doing this skill, even in the state exam. If this was a skill that you needed to demonstrate in front of the proctor, every single one of these steps is something that they should see in a certain order. Okay, right? So one of our keywords to is most important, as we mentioned in our keys to pass, right? We want to know what is the most important step. And I know you see the answer, but I want you to think through, would you have selected B, locking the wheels of the wheelchair? If you would, great. If you wouldn't have initially, I want you to think about why. And this is how you study. You want to know why your brain potentially chose a different option. Is it important to move the wheelchair close to the bed? Oh my God, yes, right? We wouldn't want the wheelchair to be way across the room or even a big gap between the wheelchair and the bed when we're trying to transfer. That is a big safety thing, right? We're going to skip over B because we know B is the answer. C, do we assist the resident to a standing position to some degree, right? If the resident is able to stand in the state of Texas, they're doing a pivot technique. So it should be a clean move from bed to chair, and where the resident is not shuffling their feet to sit down. So to some degree, yes, a lot of times if the resident is not able to bear a lot of weight, we're honestly, there might be almost in a little squatting position and we're doing it, right? Let's be honest. But I'm going to say C to some degree is a level of truth, depending upon the ability of the lower extremity of that resident or patient. Would we be using a gait belt? We should be. I know in some facilities that's not the case, but in long-term care, yes. In a hospital setting, hopefully, yes. We're going to be using a gait belt, and we're going to apply that gait belt before we even assist that resident to stand. So I hope giving you some clarity of like, yeah, all of these steps are realistic and they should be applied as you're doing this skill. But the test question is asking what is most important. Locking the wheels of the chair is gonna trump A in a way, because let's say we did move the wheelchair close to the bed, but we didn't lock it. What would happen to our patient? They would hit the ground. Period. That chair is going, is getting wings, right? And in this question, it's telling us the answer that we have to use one of our concepts is that we are prioritizing patient safety, right? That's what we're doing in this example. We're prioritizing patient safety by locking the wheels of the chair because we know we have to do that because once we sit the resident down. So I hope that helped. Put your comments, please interact. It helps with your learning. Lets me know if this helped you. Let me know if it helped. What should you do first if a patient begins choking? So I really like this question. Let's go through some answers, options. A, perform chest compressions. B, call for help immediately. C, ask the patient if they can cough or speak. Or D, start the Heimlich maneuver, right? So our key word is first. This is priority, right? And the way I want you to answer this question, you see the answer already, but I want you to think through, why is C the right answer? You know, sometimes even in learning, and I've done this when I did remediation for nursing program, and we had to do this anytime we got an answer wrong. We had to go back and remediate. It just means we have to go back and find out why it was right and why did we get it wrong. And sometimes that meant I just went back to the question in this option. Why would it be the first thing for me to see if the patient could cough or speak? So I'll think about you. If you ever had something go down the wrong pipe, a lot of times you're coughing, right? And even maybe somebody patting you on your back real hard and aggressive will move and make an adjustment of whatever it is that went down the wrong pipe, and then we're good. You're like, dang, that was a close call, right? tears in your eyes, you feeling some type of way, like, my goodness, I was hungry or whatever it is, I drunk too fast, right? So this is why C is a great first, because if this resident is able to cough or speak from A&P standpoint, air, like it, the item or the thing, the food is not completely covering what we call the windpipe, right? Or our trachea. So that means they can make an adjustment versus what typically causes choking is when there's a full blockage of our windpipe. And it's severe, right? And you have the universal choking sign, which is when the person has two hands around their throat. Then if that question gave us that, then we would know D would be a better answer, because now we know this person is in full choking. And one way, let's say the resident is nonverbal. This resident has dementia. I want to just give some more color to this question. And they can't speak because they're nonverbal. The resident's inability to even give you a hint, like yes, shaking their head because they understood the question, can let you know that we're in a full choking situation, right? What if they could speak, but they couldn't make a sound, right? They're like, "Oh, they can't." That's again proving that there is no air, right? They're in a full choke mode. So we should start the Heimlich maneuver. So knowing if the patient can cough or speak tells us what's happening. Where are we in a full, like we need to do this Heimlich maneuver, or is this a situation where we might need to just pat the back and it's going to make an adjustment, or even while we're trying to do that, this is happening. I hope that helps. The key tip that we're applying here is to pay close attention to words like first and think critically about the situation, right? If they're able to talk, speak, drink water, they're not choking fully. They're definitely, it's irritating some things, right? All right, number 3, and just remember there's a link to these questions so that you can follow along, right along with us. When providing perinatal care to a patient, which of the following steps is correct? Right? So this one would be a skills question that is being asked in your state written exam. So A, clean back to front. B, use a different part of the washcloth for each stroke. C, use the same part of the washcloth for multiple strokes, sorry. Or D, wearing gloves during the procedure. So it says, when providing perinatal care to a patient, which of the following steps is correct? Whew, right? I think this is one of those ones where you probably be shaking your head like, wait, am I reading the right thing? So rereading your question several times. 3 is my rule of thumb. Sometimes if you're able to somewhat speak, if it's allowed, you can hear yourself say the question. It's helpful. Another trick that our student coordinator brought up in a review is actually reading the answer options first and then reading the question. Now, A, we can eliminate A because we don't clean from back to front. Okay, so I hope no one thought that. We want to eliminate this completely, and I'm actually going to use my writing tool here to do that, because we should never in any circumstance do A. All right. If you have been taught in the state of Texas, you would have known that B is our procedural process for this skill. We're going to use a different part of the washcloth for each time we wipe. Another term for stroke is wiping or cleaning. We would not use the same part of the washcloth for multiple strokes. And I hope we all understand why, because of infection, right? We're cleaning to get it clean. If we're using the same section each and every time, we're defeating the purpose. So this might have been an obvious one, maybe. And then D said, avoid wearing gloves. If I ever see any of y'all not wearing gloves in this skill, I'm going to pull you aside. We're going to have a whole conversation, right? So hopefully that helped with using process of elimination. We reviewing your question multiple times. Maybe you would have had to reread A, because sometimes students, especially if you have dyslexia, you read things differently. So rereading those options, it's really, really, really helpful and important. All right, let's go to our next one. A patient has right-sided weakness after stroke. When dressing the resident, what should you do first? Ooh, this one is good. This is a skill. This is another skill that could be selected for a student in the state of Texas that is testable. So what would have helped you here is knowing the skill. It's actually knowing how your state wants you to demonstrate the skill. Um, we have a term, and I'll write it on our board here. Weak on, strong off. So that means when we are putting something on our resident, our patient, we start with the weak side. When we're taking it off, we start with the strong side. I hope that makes sense. Weak on, strong off, weak on, strong off, weak on, strong off. So in the question, applying this concept, it says a patient with right-sided weakness after stroke when dressing. So if we're dressing the resident, are we putting it on? Are we taking it off? Right? That's the question, right? When dressing the patient, what should we do first? So based on that understanding, we would do right side, right? Because we do weak on. We do weak on. So again, the key tip that we're applying in this scenario is that we are thinking like a caregiver. We're prioritizing that comfort and mobility. And why are we doing that? When you put on an item weak on first, like on the weakest side of the resident's arm, you don't have to pull or extend that arm, right? It could be very painful for the resident. So that's why we start with the weakest side when we're putting something on. And then the arm that is strongest, which is the left arm, this resident has full rotation. So they can extend it to help you with that other arm of that shirt or jacket. So we're prioritizing their comfort and mobility by using this concept weak on, strong off, weak on, strong off. I hope that helped you with that. Let me know in the comment section. Last but not least, what is the correct way to measure a patient's radial pulse? This is another skill that is tested in the state of Texas, and it could be used in a question on your CNA exam. So do we place the thumb on a patient's wrist? Do we use the tips of our index and middle finger? Do we use the tips of all four fingers? Do we count the beats for 15 seconds and multiply by 2? Right? So we should know, if you went through training, that we should never use our thumb at all, right? I don't know why I'm circling that. Let's put an X through that, actually. Sorry about that. Because the idea is that our thumb carries its own pulse. It can interfere with the reading. So we're going to eliminate A. We're going to keep B, using our tips of our index and our middle finger. If you would just bring your finger, out, your hand out, see what that feels like. If you've been taught how to measure, then that makes sense to you. So we're going to keep it. Do we use all four? I don't think you've ever had a doctor, nurse, medical assistant, or any medical professional use all four of their fingers, right? Sometimes you have to go to your life experience a little bit to inform you if you were confused on this question. We don't ever use 4 fingers to measure our radial pulse. I mean, we barely even do it manually anyway, but you get my drift. And D says count for 15 seconds and multiply by 2. So for those who have been in the industry, who have known how to do vital signs, this could be a shortcut way of getting potentially to the answer for your pulse, but it's going to mess you up in the state exam because guess what? They want you to measure the pulse for 1 full minute. They don't want you to use 30 times 2, and they don't want you to do any of those things. They want you to measure it fully for a minute using a clock that has a second hand, which is typically on the wall of the testing center. So we know now, if we didn't know, that it's going to be B. We're going to use the tip of our index and middle. If you didn't know what your index finger is, the one that points. All right. And then your middle finger. Everybody should know that one. Our key tip is knowing common procedures that are within your scope. Is it within the scope of a CNA to do vitals? Yes. So knowing how to do that is very important because you could be tested in a question, as we have done today, on your steps and how to do it. As you've seen in previous questions, should you use gloves? So knowing how to demonstrate these skills properly and correctly will be a one-up on your CNA state exam. So thank you so much for joining on our first day of our review. Keep up. Make sure you click the bell so that you're notified every time one of our videos are posted for the next 7 days, starting off on January 1st. And that way you're in the know. I would recommend bring your tablet, bring your pencil. We're going to be doing downloadables like this where you can take a snapshot on your phone and use it as a way to prep to pass your CNA state exam. Thank you so much for joining us on this review.